I'm making serious progress. We'll be talking about the Hirschsprung's disease. What is the Hirschsprung's disease? All right, it's the Hirschsprung's disease is basically, um, well, I say it's a wide discussion, all right, but I actually summarize it a lot, okay? And let's see the heading, various headings, which will be guiding us on discussing the Hirschsprung's disease. Okay, so under the Hirschsprung's disease, we'll be talking about the definition, talking about the symptoms, basically the symptoms in the newborns, symptoms in older children. Okay, we'll be talking about the causes of Hirschsprung's disease. We'll be talking about the complication of Hirschsprung's disease, and always we end up with the treatment of Hirschsprung's disease. Okay. So moving forward now, you can see this is a normal uh, colon. Okay, or we say this is a normal large intestine. All right. But now you could see that the intestine is enlarged, okay, and it could be because of various things, all right, which we'll be talking about under the causes. All right, so let's proceed, guys. With that, the Hirschsprung's disease, also known as congenital aganglionic megacolon, is a condition that affects the large intestine, which is also known as a colon. Okay, so it occurs due to missing nerves in the muscles of the baby's colon, which leads to problems with passing stool. Okay, so now symptoms of Hirschsprung's disease include in newborn babies. We say that the most obvious sign is that a newborn failed to have a bowel movement within 48 hours after birth. Okay, so other signs may include a swollen belly. The newborn baby might be vomiting, including green or brown substances. The newborn baby might be having constipation. The newborn baby might be having delayed passage of meconium, which is basically the newborn's first bowel movement. Okay. Then about older children, okay, or in adults, we say that there's a swollen belly, there's a chronic constipation, right? Because digestion is not occurring as it should. Okay, so there's like pile up of food in the stomach and gases are coming up and there's constipation everywhere. So gas is still constipation, right? And there's failure to thrive. Okay, that's like there's poor growth or development. You see the person will be looking wasted. Okay, because food is not being digested, nutrients are not being absorbed to you, so you'll be looking wasted. Okay, so this is literal. You can see a swollen colon. All right, swollen colon. Okay. Now, what are the causes of Hirschsprung's disease? The exact cause of Hirschsprung's disease is still not clear, but it may be associated with genetic mutations. Okay. So, when taking the history, you could ask the mother, was anybody in the family actually giving birth, with this kind of condition and all those stuff, right? To know if this Hirschsprung's disease is actually running in the family. The causes could be that nerve cells in the colon fail to form completely, okay, thereby affecting muscle contraction that will actually move food through the bowels. Okay, now what are the risk factors of Hirschsprung's disease? If you have a sibling with Hirschsprung's disease, you have a high risk to actually have it, okay, because it could be genetic, it could be a family stuff, okay. Then being a male is associated with a higher likelihood of having Hirschsprung's disease. Then other inherited conditions such as if you have Down syndrome, if you have congenital heart disease, you might also have Hirschsprung's disease too. Complications. Children with Hirschsprung's disease are prone towards serious intestinal infections, including enterocolitis. What is the treatment of Hirschsprung's disease? We said that surgical intervention is the primary treatment of Hirschsprung's disease, and these surgery procedures may include pull-through procedure, which is basically removing a part of the colon and connecting the healthy parts to the anus. Okay, so the part that is swollen, you cut, then you connect this side. Okay, that's pull-through procedure. They have about bowel resectomy with colostomy, bowel resection with colostomy. This is adding an external pouch to collect the feces. Okay, just like the way we do catheterization for urine. Okay, you can add an external pouch to be collecting feces. Serial rectal irrigation, and this helps to actually relieve pressure in the bowel. Okay, so serial rectal irrigation, this procedure will help to actually relieve pressure in the bowel. Okay, so guys, with that we have come to the end of Hirschsprung's disease, also known as what? Congenital Aganglionic megacolon. Okay, we spoke about the symptoms, spoke about the causes, we spoke about the complications and the treatment. Okay, so bye for now, guys.